It's a home run.
Good afternoon, good morning as well to everyone and anyone who is listening in to the recording of this webinar, the latest in our series, the On the Mend webinar world series, asking the question, is digital physical rehab a home run? And we have been talking to patients and professionals in the industry in our last three sessions, and I'm very pleased today to have the investor perspective as we look for opportunities to scale and back technologies in this industry. My name is Wesley Fogel. I am the co-founder and CEO of On the Mend. Our patient-friendly digital platform enables the delivery of personalized care to patients during physical rehab and connects them with healthcare professionals who can benefit from data-driven insights to provide more responsive care to their patients. And I'm very pleased to be welcomed here today by our two panelists, Vanloan Nguyen, founder and director of the Berkeley Pharma Tech, a biotechnology entrepreneur and seasoned venture capital fellow at Life Science Angels. Vanloan brings scientific depth and investor acumen to early stage digital health, and she advises academic and startup teams through Stanford's Spark program. She advises academic and startup teams through initiatives across diagnostics and therapeutics. We also have Nathan McNally, the co-founder and CEO of the P4 Precision Medicine Accelerator. Nathan has spent over a decade leading multi-million-pound initiatives to support tech entrepreneurs in health and life sciences. And as Health and Life Sciences Director at Capital Enterprise, he played a key role in driving over £2 billion in private SME investment and the creation of 2,000 plus jobs. And in 2019, he co-founded the P4 Precision Medicine Accelerator to foster a more connected, clinically focused pathway for AI-enabled precision medicine startups. So thank you both for joining. I will mention that we were hoping to have Dr. Baiju Thakkar, the chair of the Wildlife Clinic, and if he is able to make it during the webinar, I will briefly introduce him as well. But I think for this discussion, what we're going to do today is look at in digital rehabilitation, where the real battle is not between technology and tradition, it's between what works and also what scales. So today we are going to try and surface the tensions between clinical proof, investor pressure, and the system barriers that decide which innovations will change lives and which never make it past the pitch deck. So I think what I will do is ask Vanloan, firstly to ask from your perspective, if you could share how your framework for assessing whether a digital health solution will solve a real clinical problem, or is it just offering a scalable business model? Thank you.
Wesley, thank you for having me, and thanks for the intro. Actually, I wanted to amend a little bit. I have moved on from Life Science Angels, and I'm currently a member of 1891 Angels, which is a group that's led by Johns Hopkins alumni.
Thank you.
So yeah, Wesley, thank you so much for working on this this health tech platform. It seems like you've been dedicating years to this project, and it seems like it's taking off. So congratulations. To come back to your question, the framework that we use in the US is, for the most part, we are clinician-centric and patient-centric. So first of all, we ask, we basically look at the market and ask ourselves, well, is this a product that will be missed by therapists and patients if it were discontinued? And would it be seen as yet another tech distraction? So as you may know, in the US right now, we have such a big shortage of clinicians. And everybody who has undergone surgery knows this. You're basically rushed through the physical therapy process. The doctor writes a prescription. It says, please go see this physical therapist. And then they're basically taken out of the hospital. They're at home working on recovery by themselves. Sometimes they go to physical therapy, sometimes they don't. So adherence is really a big problem for patients. On the clinician side, because everyone is so overworked and everyone is so overwhelmed with long hours in the hospital, in the clinic, they don't really have the luxury of time to follow up with the patients on a weekly basis. So more or less, clinicians will touch base with the patient maybe once a month if we're lucky. But for the most part, it is a process that's a heavy burden on the side of the clinicians as well as for the patients. And so to find something that works for both sides, I think that the product would need to be deeply integrated into the healthcare system itself, because clinicians are time poor, like I mentioned before. We don't want to have a system that is added on top of whatever it is that they already have, and then have that be demanding on their time to actually sit down, learn a whole new system, learn to work with it, and then have that integrated into their daily workflow. So for this transition from using the old existing system to transitioning to a new platform or whatnot, you want it to be as seamless as possible, if that makes sense. And on the side of the patients, I think that having the tracking abilities to see if patients are actually adhering to the program, to see if patients are continuing to improve with their health, those are going to become really big key metrics for the digital platform.
It's interesting. And I wonder at the early stage, a lot of what you're speaking to there about the clinical, the validation, the impact that it can have on the people involved and on the outcomes. Are there situations in the past where there were opportunities that you may have maybe turned down, even if the opportunity is significant, but the clinical validation has not been sufficiently proven for you to justify backing the company?
Right. So as you may know, as investors, we get very big estimates on TAM, SAM, and SOM. And for the most part, we just chuckle and say, well, we'll see. We don't know. We hope that, the product or the service lives up to expectations. But at the point where the startup is presenting its inventions, we just don't really know if if the TAM, SAM, and SOM are really accurate. So what we do go with is that we look at mostly at traction. How many patients are adopting the technology at the level of a pilot study? What is their satisfaction level? What is their self-reported outcome? Are they actually benefiting from the healthcare platform? Are they showing improvements in their health? And what are those metrics? And in general, would the patients come back and use the platform again or recommend it to their peers? So those are really important points to consider.
That's interesting. And Nathan, are those consistent with the patterns that you're seeing to back what truly does help patients?
Yeah, I mean, ultimately, if it doesn't help patients, it's not going to get adopted, or it's going to get found out when it's in market and pulled with the regulator or the trading bodies. So patients and the care should be at the center of everything. But when you're going so early, you don't have evidence. So it's sometimes just about the founder. Are they within the system? Do they understand the system? Have they got a ready built network already? So are they engaging with the healthcare service or clinicians or KOLs? So it's also about that founder fit as well.
Interesting. And then to try to balance the pressure of scaling the business and delivering meaningful clinical value. How are you helping or have helped support companies to try and get that balance right?
Yeah, and it's the founders are on a journey as well. So sometimes they've come into our program with this idea of how they're going to change the healthcare system. They've got this grand idea, and sometimes as they go in, they find that they talk to clinicians and it's not the idea that they thought. Actually, they need to pivot, or they need to bring a feature within their platform that still integrates into the system, but actually serves a different purpose of finding that, again, that with founders fit, you have market fit as well. So it's about solving that problem.
Is that, Vanloan, is that consistent with what you're seeing in the US?
Yes, exactly. So at the level of the startup, we look at founder market fit. We favor repeat founders who has had successful exits before, obviously, but for first-time founders, we consider them as well. And it's just a matter of how adept they are at looking at the market, looking at the trends, and then framing the technology to fit those trends so that adoption can become seamless and easy for everyone.
Yeah, it's interesting. I think, when we're trying to distinguish between, having a vision, a convincing founder, and then having the evidence to back that up, clearly that is the challenge for both sides, it looks like. And I guess maybe, Vanloan, is there a way that you can assess companies that haven't yet proven long-term value? Is there a way that you approach that's systematic, or is this something that you do in an iterative process and maybe ask for feedback once you've had a first chance to meet the founders?
Yes. So having the founders pitch to us, that is the first step. The second step would be to do due diligence, doing market research on our own, and then later, if we're really interested in the company, doing site visits and whatnot. So in terms of the framework for assessing an early stage companies, we look at any data that has been generated through pilot studies. And we love to see the customer retention. We love to see any data that indicates that the patients are benefiting from the health tech platform, improving their physical conditions over time. We look at self-reported patient outcomes because, well, the clinicians obviously follow the recovery process with the patients, but the patients actually know it best. So when it comes to evaluation of the health tech platform that's designed for physical therapy, we look at we take what the patients say very seriously. And so, of course, on the technical side, we have a big team with people looking into the different facets of the technology at the startup company. But on the technical side, we also look at how streamlined is the platform in terms of integrating with EHR software. How pleased are clinicians with the user interface? Is it easy to use? Is it time consuming? And of course, managing patient confidentiality. All of those will become critical in launching a startup.
Interesting. And are the red flags for you just the inverse of that? So low levels of engagement and other data, or are there other different aspects that give you the red flags, the biggest ones?
Well, red flags for us, simplistically speaking, would be an over-optimism on the part of the founders, throwing at us big numbers about the market size, saying how they're going to conquer the world without a backup of clinical data, without a pilot studies. Those are all red flags, of course.
Got it. All right. Well, that's interesting. And Nathan, you work a lot with AI precision medicine startups. So if you can maybe talk about the way you assess the readiness when maybe, especially in this emerging area, the hard evidence is still lacking.
Yeah. So, I mean, we mentioned TRL level, technology readiness level earlier. When a company comes in, we have a team that has a background in AI, has a background in science. So we firstly pass it on to them and just get a sense check. Due diligence was mentioned earlier. So we do a full report on the technology, on the market, on the science, on the adoption, on the market readiness of what market it will fit into. Sometimes it's not the UK that's probably the quickest market to get into. Maybe it is the US. Maybe it's Asia. Maybe it's Europe. So that way, if we do kind of go and support the company and invest in the company, then we can also give that advice as well. Once we've done that, then we'll reach out to our clinical network, even our investor network as well, just to get a third angle view of the company as well. Is this something that you would adopt or expect the hospital to adopt if it came to market? If we invested in it, is it something you would co-invest in? Is it something you're looking at? And getting, again, like a startup, in getting all these signals when you're building something, just so we can sense check and have all the information before we make a decision as well. It's partly why I love doing an accelerator program and having that alongside what we do, because that also gets us to spend time with the founder. Sometimes not everything translates across a deck, across a data room, across a document. And when you spend time with the founder, you'll get under the skin of it, really under the hood, and get to know the founder, get to know kind of what their drivers are, what they really want to achieve, and can see them at work as well. Are they faking it? Is it a real company? Is it something that they will really drive for? Is it something that they'll push for through adversity? Because it's not all fun and games. It's a hard up and down journey. You get good times and you get bad times. Are they there for the long haul as well? So yeah, there's lots to assess.
Interesting. And I guess, nothing's ever clear cut or 100%. So maybe some of the interesting and most interesting areas are on the edges where maybe you don't have sufficient evidence or validation, but you still have the confidence to back the company. And in your experience, what is it that gave you that confidence, and what is it maybe from your perspective that actually was the right call to make?
Yeah, and I guess it's slightly the current climate we're in, but it seems we are not backing and venturing as much anymore. We're always asking for more and more evidence. That is falling onto the academic institutes to pay for more studies. That's falling back on maybe the public research and development funding to fund more innovation and data-driven pilots and activities. But yeah, we look at the founder first and the founding team. Have they got the right people around them? Do they know how to speak to people? And this is why pilots and just getting some evidence, I'm all for even just going to talk to your stakeholders, getting an email saying this is something that's interesting, speaking to patients, getting them all that feedback and all those data points. So even if it's not the clinical data, you're getting that soft data of, yes, they will use it. We know how to pay for it. We would commission it within the hospital. It's the same as you would do with a product or any other business. You validate before you start building. The NHS is typically very slow. So understanding that market and how you would get paid as well. So earlier in the talk, we mentioned TAM and the addressable markets. It's all well and good throwing big figures out, but do you know how much the NHS spends on your particular innovation or solution? Do you know how it's going to be paid? Is it the radiology department? Is it the therapy department? Is it the accident and emergency department? Or is it through a higher level NHS England initiative, there's loads of bits of information that a founder should know or even be willing to listen to as well when you're talking to them. So founder and founding team first. As
Sorry, please.
I was just going to say, so yeah, as I mentioned earlier, sometimes we've seen companies come in and say the NHS is our market, and then they build and they talk to the NHS and the clinicians, and they'll build something for just the pharma industry, or just a research tool for researchers, or a straight B2C product that they figured out that the patients would just buy it out of pocket because they want better care.
Interesting. And Vanloan, when are you confident venturing into the unknown, and when has it worked out for you?
Well, I've invested in companies, and personally, I have no exits yet, so I'm still learning, still on a learning curve, basically. When I decide to venture into a company, I look at the value proposition mostly, and I also, this is a little bit biased, I know, but I also kind of look at my own personal experiences in gauging to see how much of a demand there is in the market. Just talking to people around me, talking to friends, co-workers, those people closest to me, and trying to understand what the actual market is like, if there is interest in adopting a certain piece of technology or a platform. And Wesley, you work in this industry, and there are platforms and there are platforms. How do you know which one is going to be the winner at the end of the day? Personally, I like to hear from the founders stories of initial support, whether it be an email, whether it's a phone call of staff at a hospital, or maybe a patient saying, "Oh, this technology, I've been waiting for this to come along for a while now, and it's finally here, and we're excited." So those kind of messages are really heartening, and those are let's just say in terms of the pitch, those are the things I pay attention to. Now, there was once when there was this founder, highly experienced founder with prior exits, who came to me pitching his technology, and he had something similar to say along the line of, "Our patients want this, they're in full support," and then it turned out that the patient is actually the daughter of his friend. And because it's not an arm's length kind of a customer testimonial type of thing, I would tend to take that with a grain of salt. So yeah, basically customer testimonials are good, and arm's length kind of transactions are good for the pitch.
And Wesley, I'd just like to add to that as well. So so angels will maybe do more of emotional decision, right? So if they have a family member that's had cancer, they may invest in a cancer solution. Or for instance, I was premature, so I've invested in a premature diagnostic company. For an investor, it's for a VC firm, for instance, it's how much return on investment can you make for that investment firm, for their investors. So you have to balance that clinical benefit. You have to balance the emotional kind of story and what you're bringing on that side. But then it also has to be a large enough business that gains traction, that would be adopted by the health service, whether that is public, private, or straight to customer. And you have to have an answer for every single one of those.
Well, actually, Vanloan did say something quite maybe unintentionally provocative, but at the end of the day, I guess the question I ask is, what is the time frame in which you make these types of investments, so you know what the end of the day looks like? Is it 1, 3, 5, 10, or longer years? And are you comfortable making those types of investments? And how do you know which companies have the staying power to actually go through all the way to this marathon end? Maybe either can pick that up. I guess, Melon, you did provoke, so you might want to respond to that first.
Yeah, Wesley. With angel investing, we don't exactly know which startup has the staying power in the long run. We hope that whoever we're backing is going to be the right fit and has the stamina for the work. But again, we don't really know. So for the more experienced angels among us, what we say is we prefer founders who have had exits before. That is the proof that he or she can do it again. And for my part, I care more about the value proposition, what the startup is bringing to the market, what benefits it's bringing to the patients, more than who the founders are and what they have done. So I hope that makes sense.
That does, yeah. Nathan, what about your perspective on that?
Yeah, so on a repeat founder, the benefit of that is that they know how to scale a company, they know how to build a company. If it is in the same sector, if it's the health space, they know clinicians, they'll know further on investors once they build. They may have ongoing relationships with hospital groups. So in that sense, those patterns emerge where you can kind of plug and play strategies. That's great. So you may back those better or more than you would a new founder. But then sometimes I've seen great innovations fall because the technology is good, the science is good, but the founder's not being able to communicate the health benefit, how it would be adopted, what is the business model structure, and yeah, that's sad to see, because if those innovations were possibly adopted, it would improve healthcare pathways. So yeah, sometimes we do have to kind of support, and yeah, maybe not the first time round. I've had a company spin out from UCL, two professors, one who set up the first egg freezing bank at North London Hospital. Again, great background, great on paper. Two women founders working in a fertility area, and they pitched and they just couldn't get the traction. They couldn't get the investors to back it. One of them spent day in, day out at the hospital that they were at, and just got patients to sign up saying, if we would launch this, would you sign up? Can you have your name, your email? Eventually they had kind of 1,000, maybe up to 2,000 patients. They had wireframed everything out. A year or so went by, and they managed to get kind of 1.2 million investment off the bat. So yeah, healthcare is not built in a day. You have to get those proof points right. But when you do, yeah, people back it.
Interesting. Vanloan, did you want to add anything to that?
No, I think Nathan said it's succinctly enough. Thank you.
That's great. Well, I think then, looking at the exit value question and the patient value question, there are obviously key differences there. And I guess, Vanloan, what is it that helps you to identify when a company is building for patient outcomes, or just the acquisition, just looking for acquisition? How can you see when companies are working towards those patient outcome benefits versus an acquisition target?
I think that can come in as being relatively transparent, even at the level of the initial pitch. Some founders will come in with, names of companies that they have relationships with and saying this and that company might acquire us, or there's a big market and for sure we'll make it, and things like that. And so from that sort of initial conversations, we can see that they're building for acquisition, and that comes off fairly early, and that is relatively easy to spot. For the founders out there who are building for patients, I think that conversation will come off as being relatively patient-centric. Maybe they have a relative or they themselves had experienced the pain of such a disease, such a condition, and that also comes through the pitch. So I think that, there are different motivations for building a startup, and I won't fault anyone for saying what is the right way of going about it. But I think that, if we just talk to the founders, kind of dig deep and ask them questions, I think that their motivations will eventually come through the surface. And that's something that's, as angels, sometimes we relate to that motivation, sometimes we don't. It just depends on who the founders are talking to.
Got it. And do I hear from you that you do want to hear that they are designing for acquisition as well as for patient outcomes? Is that correct?
Yes, that's right.
Got it. And I guess, Nathan, then to you, how you support these companies that are trying to design for those types of value propositions and not just for an investor-friendly exit?
So, I mean, we look to build an ecosystem for companies to scale, for precision medicine to scale. That's one of our missions. So, and we look to bring down those barriers. So we are effectively just a really proactive investor supporter. Whether that is you need more data or need more research development or more IP generation, getting you in contact with those academics, those hospital clinicians to build those collaborations with. Whether it is about pilots and adoption, getting you those conversations when companies are ready. Sometimes, again, the founder takes their own time, and that's great. We can advise when to, or try and push, but sometimes we have to listen to the founder as well. At the end of the day, it's their company. But then talking to later stage investors, talking to institutional investors, talking to the stock exchange, whether it's going IPO or you are going for M&A, getting you to start feeling out industry partners, if it is the likes of a big pharma that's going to buy you out or a medical device company. So getting you to then, again, it's that high level you have, we're going to get acquired by such and such. Start having the actual conversation, start validating, build a rapport with a company. Sometimes it is serendipitous. A corporate or industry will just go, we want to look at buying out an AI-driven cancer company. And they'll just start looking at the market and they'll come, and so happens you are one of 10 and you get filtered down to 1 and 3 and they like your solution. Or it's a relationship building one going, is this something you want to develop internally? We have something externally. We could partner and pilot, and maybe I've seen big corporates invest a small amount in a company and work with them and see how much traction they do give and how much they grow. And eventually they're bought out. We do it the other way around as well. So we get sometimes big industry partners going, we want to buy something in this space. We want to buy this capability. So it's either we help build the companies, or we help see what innovations there are in our portfolio or our network, and then do it the other way and bringing those companies to those potential M&A partners as well.
Interesting. Well, Vanloan, from your perspective, how important do you see the ecosystems like P4 or other ecosystems that might exist in helping the digital health startups to navigate quite fragmented system, healthcare systems, and how are they actually removing friction and helping achieve scale?
Yeah, Wesley, there are multiple accelerators here in the US and in Silicon Valley specifically that are built to support health tech startup companies such as yours. And yes, it's true that the healthcare system is fragmented when it comes to incorporating these platforms and bringing them to the clinicians. From what I see, accelerators tend to work with the founders and in terms of getting those initial tractions, contracts with hospitals, clinics for pilot studies, and then helping them be able to gather the evidence for validated interventions, outcome measurements, and then, if possible, having published results. As you may imagine, for the more academic angel investors among us, published results means that now it's public, now it's in the papers, and it's something solid evidence that we can refer to. So that's what I have seen. What the accelerators have been doing here is helping founders get those first initial tractions, those first signals, and then aiming for wider adoptions at a later stage.
I got it. And is there anything then that they, even at the early stage, that those ecosystems and accelerators can't do, that the companies just have to figure out for themselves?
Well, accelerators don't really do the work for you. Yes, they have an ecosystem. Yes, they will introduce you to folks in the industry, those who are relevant to the project. But at the end of the day, it's up to the founders to make those connections, to do the pitches, to build relationships so that they can get to the point where they can gather the evidence necessary to push the startup forward.
Nathan, as well, what do you see as the limits and the opportunities of these ecosystems?
Yeah. So I get told a lot that companies need to focus on their home market. They need to work locally and build those stakeholders. I'm a big advocate of build fast where you can. So sometimes that may not be your hospital down the road. It may be a hospital in Newcastle or in Scotland. Have you got a driven academic partner that wants to drive innovation is a big thing. That allows you to gain that data, gain that access, gain those signals quickly. And arguably, Vanloan, we do a lot of legwork for better or worse in our team, and hopefully it does tip the balance in improving patient care. But that's why we're looking at other countries, and before COVID, the US was sometimes even our first market, not even our second. Sometimes we'd get our FDA done quickly, we'd get it done fast, and we'd get our companies into the US. We're looking at other emerging markets that want to develop healthcare quickly. The Middle East, India, Asia. Europe is opening back up again and defining what they want to do. The UK is pushing AI adoption and autonomy, automation through healthcare. So these initiatives, you've got to find which pathway is accelerating at what point you need and integrate into those. Funding is another huge barrier. You need the funding to pay the clinicians, pay the trial nurses, pay the healthcare system to even look up from caring for someone and start thinking about innovation. So funding needs to drive that research development, that innovation on every stage. And that needs to come from public and private as well. And we can lower the barriers by, getting you those conversations quickly instead of cold calling and looking in the wilderness for a contact. we can say, go and speak to so and so. We know that these are great in rehabilitation, for example. They have a great department. They want to drive innovation. They're forward thinking. Go and speak to them. So yeah, reducing time, reducing friction, and hopefully the clues in the name, accelerating the innovation.
Interesting. Well, I guess maybe Vanloan and to Nathan as well, I would ask maybe from that seemed like a lot of things that could be improved, but maybe if I could ask you one thing, if you could change one thing tomorrow that would ensure that the right and the best, let's say, digital health solutions get to succeed and get to scale in the market, what would that one thing be that you could change tomorrow, Vanloan?
That is a good question, Wesley. I'm going to say this, and it's going to seem like a very broad perspective, but I think geopolitical tensions is something that us Americans have on our mind on a day-to-day basis. And like it or not, those tensions factor into our investment decisions. If we don't see clearly in the next 6 months, 1 year, what's happening, where our country is going, what's happening with this administration, that gives us pause. And I think that, like Nathan was saying before, that funding is a barrier, and that's something that he's working to lower. I think that, yeah, going back to the geopolitical landscape, that is something that needs to cool down and calm down before we can have that peace of mind to again, drive the funds where it needs to go, health tech in particular.
Interesting. Nathan, anything from your side?
I would say the hospitals or governments or countries need to have a view or insight or a plan to where they're going. There's been so much stasis in the system, so much waiting, so much planning the last few years. Again, we're talking about the lack of even clinicians to treat patients. Really figuring out what it means to have a good healthcare service, not just a reactive healthcare service, but a proactive one that can prevent healthcare deterioration. Because again, it adds value to the economy. If everyone's healthy, there's more working hours, everyone works longer, everyone's happier. If you're happier, you're more productive. So on a larger view scale, again, it's a fabric that will underpin the benefit of society.
That's really interesting. No, I think it's a fairly strong way to end this discussion. I think we've covered quite a lot of ground. And yes, I do appreciate, that this is a complex subject, and the world that startups live in is extremely uncertain. In digital health, I think it's compounded by so many factors, and not just geopolitical. We as a company are looking to scale our operations across countries that span China and the US, and there are extraordinary difficulties in trying to bring people together. But I believe that there is an opportunity to doing that, and maybe startups are uniquely placed to be vehicles for that type of collaboration globally. So I wouldn't want to think in any limited way as a startup. I believe sky should be the limit, but obviously there are clearly barriers and challenges to achieving that. So I think today's been a really helpful way to frame the discussion, and I hope it's not the end of that dialogue, hopefully between us and others who are listening. So I would encourage anyone who is watching this recording, if they have any questions or comments to make to myself or any of the panelists, they could send them to info@onthemen.com, and I will happily pass those on. And hopefully we will continue this dialogue and discussion with other industry players and experts in future webinars. But it just remains for me to thank to Vanloan and to Nathan for your time today, and thank you to everyone who's listened in, and look forward to a future webinar. Okay, thanks all. Take care. Bye for now.
Thank you, Wesley.
Thanks very much.